Well, good morning, everyone. In contrast to my colleagues, I'm a scientist and not a lawyer. And that just means that I have a slightly different take on this. As Alan introduced me, I spent about 3.5 years in the EPA responsible for the Office of Research and Development. And in that way, I think I was more of a target isn't the right word, the recipient of data sharing policies that come from the executive branch. So Paul has done a great job talking about the legal requirements that are out there. What I want to talk about are the policies that are put forward by the executive branch. A lot of these come from the Office of Management and Budget, as we'll see. He's also mentioned the recent memorandum from Dr. Holdren in the Office of Science and Technology Policy. And these are different than laws and regulations. These are guidance. These are policies. These are not necessarily, they don't have the same sort of force as the things that we've been hearing about. So we've talked already about the data sharing requirements that come to us from the legislative branch. And we've talked about FOIA a great deal. FACA, the Federal Advisory Committee Act, actually also has requirements for data sharing. EPA has many, many federal advisory committees, and each of them, when they have meetings of any sort and they're relying on information and they're formulating their reports, that information and those data are supposed to be made available as well. And then we've also talked about the Information Quality Act, sometimes called the Data Quality Act. It actually doesn't have a name. It's just a few lines in a spending bill. And then the Shelby Amendment that we talked about. So what I'm going to touch on are just three things. Circulars from the Office of Management and Budget, Circular A110 and A130, and touch a little bit on this memo that came from the Office of Science and Technology Policy. And then I'm just going to have, I'm going to reflect a little bit on my experience with some of these issues and just give you my thoughts on perhaps where things are and where they might go. So the Shelby Amendment is important in that what it actually told EPA to do was to go out and amend one of their circulars. OMB puts together these circulars as statements of policy that go, oh, wow, what is this? I'm not even touching anything. Oh. These things that come out from OMB go out to the agencies, and there are instructions on how they should carry out some part of what they do. So the Shelby Amendment told OMB to amend Circular A110 to ensure that all data produced under an award, and this was in the case of federal grants, would be available to the public under the Freedom of Information Act. So Circular A110, as it was amended by OMB in response, I've just pulled out a few kind of highlights that relate to the topics that we're going to be discussing today. So what's interesting here is that rather than applying to research that's done within the federal government, it, applies to grants and agreements that are made by the government with institutions of higher education, hospitals, other nonprofits. These are grants. And it obligates the agency to get the research data that are underlying findings that are used by the agency in developing agency action. So this is where I'm starting to intersect with Paul a little bit. So this is building the record that ultimately underlies a decision that's going to be made by the agency. And this is an important thing that we'll keep coming back to, this question of what the science is ultimately used for. It has exemptions for a variety of things, including drafts, peer reviews, things with personally identifiable information. That's PII is what I mean there. It also exempts confidential business information. But all of these are only until the data are published in a journal or they are cited by an agency in support of an action that has the force and effect of law. I underline that. So the idea here is these things kick in when this information is ultimately used in an action that has the force and the effect of law. So keep that in mind. OMB Circular A10 is a lot about these data sharing kinds of things that we've talked about. It lays out the principles that the executive branch is trying to pursue in putting together these, in instructing or in encouraging the federal agencies, executive branch agencies, to follow in doing their work. And they have some of these same feel-good things that nobody can object to. The free flow of information between the government and the public is essential to a democratic society. So it's recognizing the underlying principle is that sharing is the right thing to do. We benefit from government information that's disseminated both by federal agencies and other parties. And the open and efficient exchange of scientific and technical government information subject to the appropriate controls, and here they include national security as well as some of the other ones that we've already mentioned, fosters excellence in scientific research and effective use of federal research and development funds. And then this goes on to have to exhort the agencies to find ways to make their information available. This is the memorandum that came out from the Office of Science and Technology Policy under the signature of Dr. Holdren. You can see it as a memorandum for the heads of executive departments and agencies. So again, this is the kind of the center of the executive branch, giving instruction, guidance, policy approaches to the other executive branch agencies. And what it says the administration is committed to doing to the greatest extent possible and with the fewest constraints possible, they want to see the direct results of federally funded scientific research made available to and useful for the public, industry, and the scientific community. Again, this is the exhortation to more data sharing, more openness in the way things are done. And again, as the same quote that Paul used, what we're trying to do is catalyze innovative breakthroughs, drive our economy, share this information as grist for new insights and assets for progress in areas that we care about, including health, energy, the environment, agriculture, and national security. So these are the policies. This is again, the center of the executive branch speaking to all of the executive branch agencies, the ones that ultimately end up implementing all of various laws that come out of Congress, a lot of those being done through regulation. We'll be talking about this a little bit, but I do want to recognize, I mean, one of the things that's clearly going on here is the world is changing, and it comes from our ability to move information around electronically. It comes from a desire for openness in the scientific community. There are parts of the scientific community, the psychology literature is in turmoil about their ability to reproduce and replicate studies, and they're working on ways to make that work better. But here are just a couple of things. This is the instructions to authors. If you want to publish in Nature, one of the arguably very best journals in the world, says authors are required to make materials, data, and associated protocols promptly available to readers without undue qualifications. They want to see data sharing there. Public Library of Science, which was the first and kind of the biggest online journal, has just published new data policy procedures that focus on public access to the data. Access to research results immediately and without restriction has always been at the heart of PLOS's mission and the wider open access movement. However, without similar access to the data underlying the findings, the article can be of limited use. So PLOS is trying to increase access to data, revising their data sharing policy. Authors must make all data publicly available without restriction immediately upon publication of the article. So going forward, I think we're going to see a different world, and this is being driven by a lot of forces. So, as Alan mentioned, I was the assistant administrator for the Office of Research and Development in EPA. ORD is responsible for doing a lot of assessments that end up being of great interest to the broader community, including interest in the kind of data that were used and how they were used. ORD does the Integrated Risk Information System, or IRIS system. It does what used to be called the criteria documents, now are called the Integrated Science Assessments, to support national ambient air quality standards. So it is right in the middle of taking a very broad range of data and processing it in a way that ends up being important to decisions that the agency makes. In my view, from sitting and being kind of in the middle of this for several years, I think that data sharing, actually, we're using these terms, but it means different things to different people, and we're seeing it used in different ways. One is access to the underlying data, and that is actually getting the results, the R over N, responses over number observed, whether it's in animal studies or epidemiologic studies or engineering studies, whatever those are from. And there's concern there, especially if these are not widely available. And these cannot be widely available because they're in the hands of researchers, but it can also not be widely available because they're considered confidential business information. And for that reason, a decision that's made that's based on data that the agency possesses might not be available either. And I see that discussion going essentially in both directions. There are people who are concerned the agency is playing around with data when they're doing their analyses, and there are others who are concerned that through confidential business information, some part of data that might be important is not being released. The other place, though, that I see this data sharing term being used, and I would say the place where I had the greatest trouble with this, is actually understanding the agency's underlying reasoning. How did the data that were available to the agency end up in this result? And one of the things that's very clear in the way in which we use scientific information and process it to inform these results is there are a lot of choices that are made. What models are we going to use? Which populations are we going to use? Which studies will we rely upon? Which ones will we not rely upon? All of those can ultimately have an influence on the end product, especially if the end product is something quantitative, like a national ambient air quality standard or a value, a reference dose in EPA's integrated risk information system. In some ways, there's more debate, I think, around this part of data sharing, understanding how things influence decisions and how decisions were made, how alternatives might have looked, that almost in sharing raw data sometimes. Now, the agency has, within EPA, there's a risk characterization handbook that has 12 transparency principles that the agency says they will try to fulfill when they're doing these assessments. And those principles really try to get at these questions of which model did you use and what would have happened if you used different ones? Which data set did you use and what if you would have used different ones? These are aspirational goals, and sometimes the agency does it well and sometimes it doesn't do it as well. The other thing that I see is that in a lot of analyses, the agency is using secondary data. They're relying on the published literature. They're not, in many cases, going out and getting the underlying data. Sometimes these studies were not supported by the agency. Sometimes they are 10, 20, 30 years old. These may be old studies that are still relevant and inform the ultimate decision that's being made, but are not, were published well before you could go download a PDF. And so for that reason, they may predate many of the disclosure rules that our journals have now and that they're going to. So the agency just doesn't use the raw data. They use the underlying scientific information. Here again, I think this is a question. This requires that reach back into the scientific community that, as you heard from Dr. Goldman, has its own concerns. Sometimes it can be handled well, sometimes it's a problem, and I know that's something that we'll be talking about over the rest of the day. And then the other thing that ends up being important is that which of these decisions, which of these scientific assessments that are being done actually are in support of an action that has the force and the effect of law. And one of the places this became important in EPA is within the Office of Research and Development is the Integrated Risk Information System. It does part of the risk assessment process. It makes judgments about whether something is potentially carcinogenic. It will set levels of exposure that are thought to be without concern. But those values themselves do not have the force of law. Ultimately, they may be used in the Air Office, in the Water Office, in the Office of Solid Waste to make regulations, but as they're performed in the Office of Research and Development, they don't. And for that reason, many interpret those kinds of assessments, which are some of the most contentious ones that the agency does, to actually not fall under some of these same sorts of requirements for data disclosure. So I think that we all recognize the importance of data sharing, and we're going to have a whole session on that. And as scientists, people recognize that it's an important part of just the scientific process. Lots of others are thinking about this too. I know we have Dr. Lowe and we have Dan Greenbaum. There's the process that's going on looking at data sharing around randomized controlled clinical trials. These have many of the same issues, say, that a lot of the environmental epidemiology that we rely upon in environmental decision making have. And there's a committee of smart people. They're working to solicit comments from the public about how to address some of these tricky issues, and I'm sure that there will be some good things coming back from them that will help think about this. The Health Effects Institute, as I mentioned, Dan Greenbaum is here, dedicated a little chunk of their winter newsletter to this question of how do we think about sharing data. And they've been involved in some of the early attempts to resolve some of these difficult issues. And so just to finish, I mean, I really do think the future will look different, and it will look different for a number of reasons. There are legal requirements, there are the scientific community requirements that we're seeing, there are just the general principles that we're seeing coming out of the policy arena that will lead to more disclosure. And in many ways, I wonder if this is a situation where our big challenge is thinking about the things that are happening today or happened in the past, where some of these norms and some of these requirements were not in place. And our challenge may not be thinking as much about what's going forward as it is what do we do about things that have happened today or happened in the past. With that, thank you very much.